Hi, I am Dr. Yeshwant, Director, Atharva Infertility Center, Nashik. I am a practicing IVF specialist since last 15 years. Today we will be discussing on when we should take a decision to start IVF treatment. So after initial investigations and a proper history, the doctor assesses what is the actual cause for infertility. The cause for infertility can be divided into either the factors in the female, factors in the male, or it could be combined factors in either the husband or the wife, or in very few cases it can be unexplained infertility. Now what do you mean by unexplained infertility? To conceive naturally, a couple should have three normal things. One, she should have patent fallopian tubes, she should be ovulating at monthly intervals, and a husband's semen report is absolutely normal. So when these three factors are normal and the couple fails to conceive, then they are labeled as having unexplained infertility. So how do you define infertility? Infertility is defined as inability to conceive within 1 year of marriage with regular unprotected intercourse. Suppose if a female marries at the age of 35 and above, then this duration of 1 year is shortened to a period of 6 months. So a girl marries at the age of 35 and she doesn't conceive within the next 6 months, she should consult the doctor immediately, because the fertility potential and the age of the female has a direct correlation. So what are the factors the doctors see and then suggest that you need to undergo IVF? Now in the female, the factors are broadly classified into ovarian factors, tubal factors, uterine factors. Now if you see the tubal factors, if the fallopian tubes are bilaterally blocked, they are badly damaged, or if they are having hydrosalpinxis. Hydrosalpinx means fluid collection in the fallopian tube. That means the fallopian tubes are completely damaged. So in this type of fallopian tubes, a natural pregnancy is not possible. The other factor is ovarian factor. The most common ovarian factor we tend to see in clinical practice is PCOD or polycystic ovarian disease. Now, if you do an ultrasound scan of these females, you will see multiple small follicles less than 10 mm size arranged in the periphery of the cortex of the ovary. The ovarian volume is enlarged and the patient gives history of irregular periods. Some females may have periods only after taking medicine. Suppose these females don't conceive with simple tablets of ovulation induction or injections of gonadotrophins, or even if they ovulate and they don't conceive within a reasonable time of 3 to 6 months, then these females are advised to undergo IVF treatment. In the uterine factors, you need to assess the uterine cavity from inside and the uterus from outside. So if you assess the uterus, you need to see any fibroids, any adenomyosis, which can be diagnosed on ultrasound, and a hysteroscopy will help in diagnosis of any abnormality in the uterine cavity. Hysteroscopy is a gold standard where a patient under anesthesia, a camera is introduced in the uterine cavity and the place in the uterine cavity is seen for any fibroid, any polyp, any adhesions, or any septum. If there is any problem inside the uterine cavity, these problems can be rectified to majority of the extent. But in cases of very severe Asherman syndrome, that is having multiple and extensive adhesions in the uterine cavity, that is covering more than 2/3 of the uterine cavity. In such cases, IVF is the only option, but they will require surrogacy, because in such type of cases, even after extensive correction of Asherman syndrome, the success rate following IVF is on the lower side. Now these are the factors in the female. If you see the factors in the male, a simple test of semen analysis with usually 2 to 5 days of abstinence is the gold standard for diagnosis of male factor infertility. When you assess the semen sample, we tend to see for few things. We need to see the count of the sperm, you need to see the motility, and you need to see the morphology. So in majority of the cases, the semen analysis usually have multiple abnormalities in the form of low count, low motility, and abnormal morphology. Also in some cases, we'll do a routine DNA fragmentation index of the sperm sample, and if it is more than 30, then these males, even if they are having a normal semen count, motility and morphology, these males have problems in conceiving. So in such type of cases where DFI is more than 30, what we suggest to the patient is, instead of using the ejaculate sperms for IVF, we directly do testicular aspiration or testicular biopsy and get those healthy sperms from the testes from where they are produced, and with those sperms you can do ICSI. And we have seen very good results in males who have a DFI more than 30 with repeated implantation failure and repeated miscarriage. Apart from this, the few other indications like IVF is suggested by the doctor is in girls who have absent uterus. This incidence of condition is 1 in 5 lakh female. Suppose these girls are born with congenital absence of the uterus, or the uterus is hypoplastic or small in size. So conceiving naturally in these girls is very difficult, or it's not possible. So what we do at Atharva Infertility Center is we do ovarian stimulation of these girls because they have a normal functioning ovaries. We do an ovum pickup, we take his husband's semen sample, culture the embryos and transfer into a surrogate uterus. So these are few indications where doctors suggest that you need to undergo IVF. If you have any suggestions, if you have any comments, do write to us. Thank you.